Hi there, I'm Koyleeeezs, student physical therapist, and in today's video we will be learning how to do the scapular load test. Involved in the test include the trapezius muscles as well as the rhomboids. The structures involved in the test include the anterior glenohumeral ligaments as well as the posterior capsule. The normal resting position of the scapula as it lies on the posterior rib cage is at an angle of 30 to 45 degrees. The shoulder has three planes of motion: abduction and adduction in the frontal or coronal plane, flexion and extension in the sagittal plane, internal and lateral rotation in the transverse plane. This is a standing position. The therapist position has to be beside the area or the arm being tested. So in my case, I'm going to be testing the patient's right arm, right shoulder. In order to do the test, the therapist applies a pressure in between the forearm and the arm. So like this. So what the therapist wants to do is to apply a little bit of pressure downward, upward, in front, or towards the back. And you tell your patient to resist the force being applied by the therapist. So the instructions that you want to give to your patient are the following. So sir, what I want you to do first is to please put both of your hands towards your waist, just like that. That way, the patient is already performing 45 degrees of shoulder abduction. What to do next is to apply a little bit of pressure on the area that was mentioned a while ago, just like this. So you tell your patient that you're going to be applying pressure. So sir, I'm going to be applying a little bit of pressure, and what I want you to do is to try and resist the force that I am giving you, okay? So just like this. Next, you want to give a force towards the front. And then the back. And then above. Just like that. Test is considered to be positive if the scapula moves for more than 0.75 inches or approximately 1.9 centimeters. The test is also considered to be positive if there is instability due to muscle weakness. Furthermore, the test is also positive if there is excessive movement of the joint. Last but not the least, the examiner also has to take note of any form of scapular winging located on the scapula, which is indicative of scapular instability. Now, the test is considered to be negative if the scapula does not move for more than 0.75 inches or approximately 1.9 centimeters, which means that the scapula is normal.